Hi, everybody. It's Patricia Coughlin, and I'm going to continue on this theme regarding the portrait problems that you can run into along the way. I've been getting a lot of comments and questions about what do you do when anxiety and defense crop up in the middle of a portrait. So let's start with what is the point of the portrait? What is it really designed to do? And then we can look at what are some of the problems along the way. So the portrait is really a way of helping patients access, experience, and then integrate their complex mixed feelings toward others. So that's the first really important thing to remember. This is about experiencing complex mixed emotions. It's not just about anger, right? That's often just the tip of the iceberg, right? So we want to help patients experience their reactive anger toward people who have hurt them. So there's going to be pain and grief there. And then also very often guilt about their anger and aggression because they love this person. So that's the first goal. And the second is that at least Davenlu found, and I think many of you have probably experienced this as well, that in the process of helping people relinquish defenses in order to experience these complex mixed feelings, that triggers an opening into the unconscious, revealing the source of this conflict from the past. So accessing the unconscious, getting to the bottom of these repetitive difficulties is the other goal. So what can get in the way of that? Of course, these are general comments. The only way to know in a particular case is to understand that case and actually see the tape. But these are things that I notice, as I teach and supervise. And a lot of it has to do with some real misunderstanding on the part of the therapist as to what is actually going on in this process of the portrait. You can only know what to do once you understand what's happening. So if we take an example of a patient who, let's say, is depressed and has some physical pain, you discover this is the result of a chronic tendency to suppress anger and turn it back on the self, with depression and pain the result. So then you're going to help the patient to actually experience this anger, right? Again, in a particular symptom generating situation, right? They got depressed over the weekend. What happened, right? Somebody canceled a date with them. Okay, so you're going to start with what do you feel toward that person and help them to actually experience at first, again, the anger and then the mixed feelings. So let's say the person is initially able to experience this anger, but then they might say, oh, and then you say, okay, so you're feeling this anger, this heat and energy coming up in your body. I see your hands starting to go. What's the impulse? At that point, again, the conscious mind might say, oh, nothing. I mean, I'm not a violent person. So again, you might have to clarify. Yeah, I'm glad to hear that. And we're not talking about you actually doing anything, but what are you feeling in your body? Like in your imagination, if you lost control, what would happen? So let's say they're able to actually experience that. I just felt like shaking him, punching him in the face, whatever. And then you're going to, as the person is experiencing the anger and the impulse, you ask, is that it? Is it all out? Again, often we'll see in, videotapes of experts where this just seems to flow, quite naturally, right? They go from anger to impulse to tears and grief and guilt and love, and it all seems to happen quite effortlessly. But this, this is probably the exception. That even when patients are able to experience initially this anger and rage, they're going to defend against feelings of guilt and love, for example, right? That it's relatively easy just to feel one thing towards someone, but it's these mixed feelings that we often have difficulty with. So you might see the person, kind of stop at that point and say, yeah, I was angry, I got it out, now I just want to leave. And you don't want to leave it at that point, right? You want to have the patient look right into the eyes of the person that they have assaulted or killed in their mind. And you're really going to want to access those feelings of guilt and grief that are then tied to love. So you might see some defense come up around that, and you're going to have to press to that, right? So I'm thinking of a recent example where this patient with really debilitating symptoms was able to get in touch with this tremendous, really sadistic rage toward her father. And she just felt better, for having experienced that. But I knew that she had really been punishing herself severely, basically had herself in solitary confinement. And so I knew there had to be other feelings there. But just trying to press on the guilt didn't go anywhere. So this is where, again, your understanding of the patient and of these dynamics is essential. And I just said to her, so you're saying anger is the only feeling that you have towards your father? And then she said, oh, well, no, I love him too. I really love him. And then, right, the guilt and the grief emerged quite spontaneously. So, you've got to be somewhat flexible there and spontaneous, right? Understanding what they're defending against, right, with those mixed feelings and finding ways to help the patient access it. The other thing that can happen is that you get a sudden rise of extreme unconscious anxiety in the middle of the portrait. Now, again, you have to understand, why would this happen and why is it happening now in order to figure out how to intervene. So I often see that when patients start to experience rage toward you in the transference or someone in the current, and then they suddenly get this spike of anxiety, might even get a little dizzy. The therapist thinks that they're anxious about their anger, and they start to lower the anxiety. Now, of course, you're going to have to lower anxiety if it's so high that the person is getting dizzy, but they've already experienced the anger and the violent impulse. So why would they be feeling anxious afterward, right? So what I often find, and again, you really have to watch the patient closely, you're going to see that they're suddenly their eyes are going to go off. They're going to even go like this or cover their face. And it's clear the unconscious is letting you know that they have just seen something. There's been this unlocking of the unconscious, and suddenly another face has appeared. I'm thinking of a case of a woman with panic attacks. It was around her husband getting home late from work. We were able to access that she was absolutely enraged with him. And she had a murderous impulse toward him. It was in the kitchen. She was going to grab a knife. She stabs him. He goes down. And it's when I asked, what does he look like? She said, white. No, no. And she starts to hyperventilate. Orange, right? Now, clearly, right, she saw something, right, that was suddenly so anxiety provoking, so overwhelming, right, that she really went over threshold. So I had to bring her down, slow her breathing, get her back online, and then ask her what happened there when you suddenly said, I see orange. And she said, I was right back at the age of 12 at the coffin of my mother. This woman had died of liver disease, and she looked kind of orange. So that was so anxiety provoking, because she then realized that she'd been very angry with her mother for getting sick and going into the hospital again. By the time she got there, her mother was in a coma. She didn't understand this, and she just felt angry. I came all this way, now you won't even talk to me. And she left feeling really angry with her mother, and then her mother died. So there was enormous guilt. So this is the other thing that will often happen if there's a sudden spike of anxiety in the middle of the portrait after they've already imagined, right, hurting you or somebody else. Chances are, again, they've seen, there's been an unlocking, there's sudden unconscious material surfacing that is really terrifying. So bring that anxiety down. And once they're, coherent again and back with you, go back to that point and ask them, I wonder if you saw something or someone else came to mind, and then they'll be able to tell you what happened there. So again, this is all significant and it's all important. Don't abandon ship because anxiety or defense enters. It's telling you something. And so if you can stick with it and understand what would be prompting, what are they defending against at this point? Again, is it the tender feelings or the guilt-laden feelings, or why would they suddenly become overwhelmed with anxiety at this point, right? They must have seen something came up from the unconscious. So I hope this helps you. Again, very interested in your comments and questions, and we'll keep going with this. Thanks. Bye-bye.